Hello, and thank you for joining us for today's webinar. We are having a presentation on Lumecca by Dr. Mark Taylor from the Gateway Aesthetic Institute and Laser Center in Salt Lake City, Utah. Dr. Mark Taylor is a world-renowned dermatologist in practice for over 30 years in one of the largest dedicated cosmetic centers in the world.
Very good. Thank you so much. It's good to be here, and it will be fun to talk about Lumecca, this IPL technology, and how we use it and our experience with it. So with that, maybe we can begin. The Lumecca IPL is a new addition to the aesthetic armamentarium. This has undergone a lot of research and development from the best in the world. So let's start with some basics about how IPL differs from a regular laser. Lasers have only one wavelength of light, so they're called monochromatic, and IPL is broadband light with many different wavelengths of light. Lasers are a coherent beam, and IPL is non-coherent. We'll have a slide in a minute that illustrates that. The beam delivery is on a laser, but an IPL uses a contact crystal that is in direct contact with the skin to transmit light into the skin. Lasers have a relatively narrow clinical spectrum, whereas IPL has a broader spectrum of applications. The laser light is produced in a laser cavity, and on an IPL it's produced in a flash lamp with multiple colors of light. And a laser is a collimated beam, so it can be transmitted over a long distance, such as a laser pointer, whereas IPL is non-collimated, and that's the reason it needs to be in contact with the skin during treatment. This slide illustrates some of that technology. If you notice at the top, coherence means that all of the wavelengths are in sync, whereas the light from a IPL is like a light bulb. It comes out with many different colors that make up the white light. The laser, again, is monochromatic, so it's going to be one of those colors that you see in the spectrum, whereas the broad spectrum will be many of the colors depending on the cutoff filter that's used in an IPL. And typically a cutoff filter eliminates the wavelengths of light that are below that cutoff. Collimated on the bottom means that it's in a tight stream of light similar to that of a laser pointer, and non-collimated would be like the light on your ceiling. It goes on and it's bright and illuminates the whole room. And the Lumecca IPL is excellent for the treatment of unwanted superficial skin, pigment, and blood vessels. So if you think about it as removing the unwanted reds and browns from the skin, then that's the primary indication for Lumecca IPL. The challenge is always to build the best IPL with a flash lamp that produces the right wavelengths, recycles quickly, is cooled efficiently, and I think we'll be able to demonstrate that the Lumecca IPL is an outstanding achievement in those areas. This explains here how cutoff filters work. In the shorter spectrum, you have the greens, such as the 515, and then progressively you have longer wavelengths through the visible spectrum up to 755, and then you end up in the invisible spectrum, the near-infrared spectrum. And so cutoff filters in the Lumecca go from the 515 up into the near-infrared spectrum with a broad range of selectivity and clinical efficacy. Here we look at selective photothermolysis that is important in all of the laser and light applications, and the two major chromophores that we're looking at when we use IPL is oxyhemoglobin and the melanin absorption. And this curve shows you the spectrum over which light is absorbed by those two chromophores. And with IPL, you get a broader spectrum of absorption than you do with a single wavelength laser. So for that reason, you have a lot more potential applications that you can use with IPL. Here are a few of the Lumecca advantages that I think are important. You have both 515 and 580 applicators, which allows you to treat reds and browns in both lighter and darker skin. It's important to have short and long pulse durations that are variable so that you can treat larger and finer skin pigment and vessel targets. It's also very important to have both a slow and a fast recycle time for greater office efficiency. If you're going to use your time and your energies, your staff efficiently, then you want to have a device that will work at the speed that is comfortable for the provider. Also, having variable cooling options for patient comfort and also for efficacy. It's also very important to have a device that is comfortable to use. It's not too heavy, it's not awkward to hold, and that you can use many times a day without fatigue or causing discomfort to the operator. The lightweight handpiece on the Lumecca is great because it does allow the operator to use it with much less fatigue. Some of the IPLs in the market have a very awkward position that they need to be held at, and over a period of time can actually cause cramps and other issues if they're used frequently. Also, many offices have limited space for such a device, and so having a small footprint can economize on office space, and this is a very tidy box with excellent economization of office space. Go to the next slide here. So let's talk a little bit about how this IPL is designed and how the spectrum of light is emitted and why that's important. This was designed with a left shift output spectrum. That means that more of the light is in the visible wavelengths in the 500 to 750 range, so that more of that light will be absorbed into the reds and browns that you're trying to get rid of when you're treating a patient. The handpiece also has the ability to use either the 515 applicator or the 580 applicator. So if you have a fair-skinned patient with light skin that has basically translucent skin and will transmit the light efficiently and carefully through the skin, then the 515 applicator will be excellent in treating things like lentiginous and fine vessels. Whereas if you have a patient who's a type 3 or 4 skin, possibly with a little bit of tan, then you'd want to use the 580 because that allows you to be more protective of those pigments in the skin while still being able to treat unwanted pigment and unwanted vessels. So going down here, looking at the ideal skin rejuvenation device, you want something with high peak power. You want a large spot size so you can treat the patient quickly. It's nice to have the cooling and the sapphire tip. A high pulse repetition rate is very, very helpful to just speed up the treatment, allow you to be efficient in your office and use your office time and staff efficiently. It's also nice to have a device that is small and ergonomic. We mentioned the small footprint of this device in the office, and also a very efficient and reliable, long-lasting lamp, such as the low-pressure xenon lamp that is in this device. And then we mentioned earlier the left-shifted photon spectrum that allows you to treat a wider variety of targets in the skin. This just gives some of the specifications for the Lumecca SR 515 and 580 handpieces. It's an IPL technology. We'll explain the difference between that laser. It has a nice large spot, very quick repetition rate, which I love personally. You have the two spectrums from 515 to 1200 and 580 to 1200. Fluences allow you ranges from a very careful, low-level area up to very powerful 30 joules per centimeter squared with high peak power of this type of a flash. Also, you have the choice on the device of choosing a short pulse, which is calculated by 30% of the fluence in milliseconds, or a long pulse, which is calculated by 50% of the fluence in milliseconds. And then you can choose the cooling to have the amount of cooling that you want. If you're having trouble with, say, fine vessels, then typically you may want to turn down the cooling a little bit. If you're treating someone with a little bit of pigment and a little more risk, then you probably want to use more cooling. And over time, that becomes second nature as to how you want to use the cooling as you're doing treatments. This is a chart that just explains how the pulse duration changes with the fluence. And there are charts and helps and so forth that come with the device, so that if you want to look at this and plan your treatment based on how many milliseconds you want and how much fluence you want, then you can simply look at those charts and pick the settings that you want to do your treatment. So let's talk about what's special about Lumecca. Combines the advantages of IPL with these large spot size, versatile spectrum, high efficiency, and the two cutoff filters, two different handpieces. We talked about high peak power, which is very nice and allows you a lot of versatility. Also, a lot of the energy is concentrated in the effective range of the KTP pulsed KTP or the pulse dye range. And I mentioned the high repetition rate, the nice ergonomic design, and the low pressure xenon applicator. Here is a video that I produced to show how I use this, and the cooling pop that's made of water and gel is used. It helps the device slide across the skin. It also gives cooling as we're doing the treatment. What's more special is that this was developed by the chief scientist of the original IPL device, the Photoderm. I've been doing IPL treatments now for 20 years, and I used the original Photoderm and actually did some of the studies on that device before it was FDA approved. So I am very familiar with this chief scientist and all of the stuff that he's created over the years. Very smart guy with a lot of ingenuity, and so you can rest assured that the best engineering has gone into this device. Talk about very high output, also acts a lot like a 532 KTP or the pulse dye laser, depending on the modes that you choose, the cooling and the peak power. And so all of this, again, is a very nice package of technology and user friendliness to the device and clinics. Here is just some ideas of how we test the epidermal tolerance. With IPL, it's very important to have only the targets picking up the energy and not producing any of the rectangular appearances, as you see here in the bottom test. So, for example, when we're treating or testing the device on freckles or lentigines, we want to see a little bit of graying of the pigment only in the freckles and not in the normal skin. When we're treating vessels, we want to do a test and see that the vessels are either disappearing or blanching or turning purple or a little bit gray but only the vessels and none of the normal skin. Frequently, when we're first treating a patient or first learning to do IPL, it's good to do a test patch and then go see another patient for a few minutes and then come back and look at it and make sure that only the target is changing and not the normal skin. So, the shorter pulses of lasers, this is typical of the pulse dye laser with the purpuric spots. It's possible to use the short pulse on the Lumecca and have effective treatment of vessels when treating vascular lesions without producing this much purpura or with no purpura at all. In longer pulses, and I use that primarily when I'm treating pigmented lesions, you can cause changes, either graying or darkening of the pigmented lesions, freckles, etc., without causing darkening or blistering or changes in the normal pigment in those patients. So here we have a few clinical slides. This shows the 515 nanometer handpiece, shows the settings with the cooling to treat vessels in someone who has fairly transparent skin, not much pigment, and you notice the nice response. I believe this is a before and after photo by Dr. Bickeroff. Here's another one showing the same kind of a nice response. Here we show very fine telangiectasia. When doing this, typically this is a short pulse and maybe a little less cooling and a little bit of purpura, which is okay. That just lets you know that you've delivered enough energy to be able to burst those fine vessels. This will go away within a week to 10 days and will be covered by some mineral makeup, and is evidence that you've had a good response on fine vessels or the facial redness. Here we have another 515 treatment with good cooling, nice, excellent response. Nice before and after. Another vessel that is very close to the surface, very red in color, on a very light-skinned patient. This is the dream lesion that everybody wants to treat because they respond so well to this technology. This is a patient that I have treated, and if you notice, he has a little bit of photo damage, a little bit of dyspigmentation, fused telangiectasia. Just wanted to have some gentle rejuvenation, and I think you can see a nice improvement in the skin lightening, the vessels on the mid-cheeks, and no significant downtime or adverse effects to recover from this patient. Very happy with his treatments. Here we have some fine vessels and pigmentation. I just think you can just see a general clarity and translucence to the skin improve after treatment. Same thing here. Subtle pigmentation. You see a few light lentiginous scattered to the malar area. Here we see a much clearer, nicer result after treatment. Here's a patient that we actually do somewhat of a therapeutic treatment with, has rosacea lesions, inflammatory papules, some redness, some telangiectasia, and improvement. So we found IPL to be very, very effective in treating patients with rosacea, along with any medications that they may be using. And this is an adjunct, helpful to further improve them and help the redness that may result from that condition. Here we have short pulses primarily for the little lentiginous in the mid-face area with nice improvement. Probably a couple more treatments with finish getting rid of the rest of those. Can be used off the face, on the trunk. We use it a lot on the arms and hands, the décolleté area. It can be used just about anywhere if you choose the skin type and the indications properly. again, some large lentiginous inflammation from photo damage and nice result here after some treatment. Helps even out the pigmentation. A lot of patients will go into a maintenance mode and do one of these treatments 2 or 3 times a year. It has also been shown to actually help wrinkles and the general condition and appearance in the translucence, light reflective. So it's a very well-received treatment by many of our patients, and they will come in and do it on a regular basis because they love the way it looks on their skin and the way it keeps the pigmentation and redness away. Here's an example of it being used on the arm. I often, when I have a large lesion like this lentigo here, will do a cutout that just exposes the large lentigo by itself, and may even use that with a little more energy, occasionally even with a bit of light blistering or scabbing if it's a recent lesion. They heal very quickly. It's that much safer than treating this with something like liquid nitrogen that may leave a white spot. Again, you can notice how this is evened out, just the overall tone, texture, and pigment in this patient. This is one of my patients with fairly prominent lentiginous over the mid-face and a little bit of the lower face after just one treatment. This type of patient is very thrilled. They will tell their friends and send them in, and they'll also do other treatments like neurotoxins, fillers. Later on, when they start to sag, they'll do skin tightening and things like that. So this makes a very happy patient. So, in summary, this is a very high-tech IPL platform for an industry veteran, highly efficient, great speed, quick turnaround, and increased profits. Broad spectrum of effective clinical applications, a quick startup, very easy operation. The device has a small footprint, very mobile. We can easily room to room, and if you have a minivan, you can probably easily move it from office to office. There are also additional revenue streams available on the same platform, skin tightening, hair removal, and fractional micro-needling of RF, so it has a lot of capabilities. You can see results very quickly, as with that patient I showed you with the lentigy, after just a few treatments, as compared to some other devices that may require more treatments. So that's kind of my summary of this neat device, something we use a lot in the office, and something that is very nice results for a lot of our patients.
With over 50 lasers at your clinic, how popular is IPL compared to other treatments?
IPL is close to the top in popularity. It's an asked-for procedure. It's something that people do many times and year after year, and it's one of our most affordable procedures, and people are just very happy with the results. So it's near the top of the list of light laser and IPL type treatments.
What is your patient base comprised of? Do you have more patients with vascular lesions or photo damage?
It's actually mixed, because almost everyone has a little bit of both. They will have some redness here and there, especially at the corner of the nose, a little bit in the mid-cheeks. They will, nobody's perfect in wearing their sunblock, so they're going to get a few freckles here and there on their face, on the décolleté, on the back of their hands. We live in a world where you just cannot avoid some sun damage, and it produces the kinds of things that this device treats.
Do you use Lumecca on all your patient base?
Well, IPL should be very conservatively used on on tanned patients and patients with very dark skin, like type 6. And the reason for that is that when you get into really dark skin types, the normal skin color is competing for the light with the target that you're trying to get rid of. So you always need to have a differential between what you're trying to get rid of and the color of the normal skin. Otherwise, you run the risk of leaving rectangular burns and issues that can cause you a headache. So, there's a limit to who you can use this or lasers or any device on, and you need to have good judgment in what you use it on, who you use it on.
How does Lumecca perform compared to other IPL devices?
Well, the thing I like about Lumecca is so easy to use, very quick startup, very comfortable handle or hand keys, very reliable, the nice cooling, the very fast speed. I don't know that there is a faster IPL on the market than this one. It is absolutely speedy, and time is money. You're taking time and trying to treat people and get them taken care of and out the door so you can see the next patient. And if you can do a IPL treatment in 5 to 10 minutes instead of 15 to 30 minutes, then you can see 2 patients in that period of time. So that's pretty important.
What advice do you have for physicians who are just starting to use Lumecca?
Very important is, first of all, try to find as many type 1 and 2 type skin to treat, and start there so that you inherently have safer patients to work with. If you're starting to treat people with pigment and who may be a little tanned or a little bit olive complected, I recommend doing test patches. Cut out a dime-sized area in a wet piece of gauze, put it over a typical lesion for what you're trying to treat, and do a test pulse. Tell the patient you're going to be back in 15 minutes and take a look at it. And if you come back and you see the kinds of things you want to see, like little gray speckles only in the freckles, and you see that the vessels have blanched and that the normal skin around them is not red or irritated, then there's a pretty good chance that you've chosen the right setting and could go ahead and do the treatment. So those test patches over a period of time are until you really get good at it, can save you from making mistakes and help you to learn what you're doing and how to choose the settings for what you want to treat.
What advice do you have when setting energy levels?
The power level depends on what you're trying to treat, and really you can't choose a setting that fits all. There are some guidelines in the literature and charts and so forth that come with the device that get you into the ballpark, but then you need to be able to recognize what's happening to the skin from your test areas so that you can see what's happening and if it's correct and safe. And that comes with the training that is provided by the company when people buy the device. You can also go visit a clinic that's busy using such a device, and maybe spend the day with them and learn a bit more about that.
What kind of training would be necessary to be both safe and effective when using Lumecca?
I think it's really important to spend time, and hopefully, if it's going to be delegated to a paramedical person, as I do in my office, I have a nurse and a PA and some estheticians that do these treatments. My nurse and PA actually spent 6 months with me before they actually got to do their own treatments. That's not necessary with the newer equipment, but I think it's important to have enough time and understanding and do enough homework on your own that you understand how to pick the proper lesions, that you know what you are treating, and also that you can recognize different skin types so that you're not treating someone that's too dark with aggressive settings and causing issues. We're much better at training now than in the early days, so I think training a few days to a few weeks, depending on what people want to do and what they're going to treat, is important so that you treat people effectively and safely.